Hello everyone and welcome to another episode of Ask Dr. Bob. Some very interesting questions once again. Someone was asking me about how they could lower their cholesterol and triglycerides naturally. This is what I have learned. If you have elevated cholesterol, let's say it's 250 and above, and your triglycerides are normal, and triglycerides are blood fats, you probably have stress. If your cholesterol is 250 and your triglycerides are also elevated, you probably have your hand in the cookie jar because the sugar is being transferred or translated also over into the triglycerides. I oftentimes see a lot of individuals are put on statin drugs. It's not anything to do with their diet. It is stress. The same individual wanted to know they're type 2 diabetics and what should they do. Well, first you want to get off all fruit, anything sweet. You want to make sure that you're exercising. Exercise is your secret weapon because it's going to have the muscles put a demand on your blood glucose. Very good questions. They also ask how much vitamin D they should be taking. Well, that all depends on your vitamin D3 blood test. I take about 4,000 international units a day. Your vitamin D3 should be about 40. We use a liquid vitamin D. If you do not have a vitamin D level of 40, you may consider taking 1,000 or 2,000 international units every day. Someone had a question about kidney stones and what causes them and does apple cider vinegar help? Well, first, minimize or eliminate soda. Drink more water because soda itself, the phosphorus, will throw the system off. I have also learned that it could be a phosphorus and a calcium imbalance. If you have too much calcium and not enough phosphorus, you could have calcium precipitating in the stones. So sometimes what we see, if somebody has adrenal gland exhaustion in their parasympathetic nervous system, I know this is heavy duty science, but I want to help you, increases, we may have to use a product called superphosphozyme, which is a liquid phosphorus. It is available on our website. I'd also encourage you to get Dr. Bob's Guide to Sex and Romance. So what does that have to do with kidney stones? We talk about the parasympathetic nervous system there. As a FYI, if you have kidney stones, a wedge of lemon every 15 minutes. So you get a wedge of lemon, put in some water to get that tartness out there, eat that wedge, drink 4 to 6 ounces of water. Do that every 15 minutes until your kidney stone pain goes away. You'll be pleasantly surprised. Someone wanted to get off of a blood thinner. Now, this is what I've learned about blood thinners. I don't have a license to take anybody off of any medication, but I just finished 15 minutes ago doing an assessment on somebody with an essential fatty acid blood spot test. You want to make sure that your essential fatty acids are balanced, that you have enough omega-3 fats there and not too much of the omega-6. So, marine oil will help keep your blood thin. I don't promote anybody taking an aspirin. You're tricking your body. I talk about this in great detail in Dr. Bob's Trans Fat Survival Guide. Getting off a blood thinner is quite tricky. If you're a female watching me right now and you're 50 years old or older and you're starting to feel these heart palpitations and they want to put you on a blood thinner, you probably should have a consultation with me because you have probably a magnesium deficiency which can cause heart palpitations. Somebody made a comment on Facebook in reference to the left neck pain and was an eye-opener to them. I want you all to know that left neck and mid-back pain can commonly be caused by bananas, raisins, grapes, pineapple, dairy, and sugar. Last question, in regards to not taking sleep medication, what about melatonin? I have had many individuals use melatonin to help them with sleep. I can tell you from my experience, if you have challenges falling asleep at night, your adrenal glands are probably hyper-accelerated. Don't eat any sugar. Get to bed by 10. Exercise earlier in the day. If you have noticed that you're having problems falling asleep at night, don't exercise before you go to bed. It's going to raise your cortisol level. Great questions. Thank you for joining me with the Ask Dr. Bob. Look forward to speaking with each and every one of you next week.